Exciting news we just delivered. There's a lot of energy around this, and as you heard, it's got a huge social equity component. It's going to do so much to lift up the neighborhood of Southeast Queens and create opportunities for individuals, as well as restore a sense of pride when people land at JFK and they live here and they know that the rest of the world is seeing a facility that is second to none. So I was really proud to be able to preside over this today, and thank again, once again, Rick Cotton, our executive director, and at that point, I'll be happy to take some questions.
Governor, many counties or county executives are saying that they're not going to enforce this new mask mandate. What is your response to that? Does it undermine the effort that you're trying to do to have a statewide policy?
Well, every county is different, and I've spoken to many of them. Some county executives have asked us to do this, so they have what I would call air cover, something I've had calls from even in some of the more rural areas where they're grateful that we did this, so they can explain that this is a statewide mandate. So there's a difference of opinion. I do have faith in New Yorkers. I believe that the vast majority want to do what's right. They want to put this pandemic behind us. They want to make sure we never have to go back to the days of being in lockdown where you couldn't go to work, you couldn't go to schools, you couldn't go to worship on a weekend. And so we're not going to do that. And I said very strongly, this is all about two things: protecting the health of New Yorkers and the health of the economy, and I believe we accomplished that. So I do hope that the businesses will enforce this and that individuals will understand how important it is. It's a temporary measure as long as people follow it, and I wanted to make sure I gave some very clear guidelines on how that's going to be executed. It's not indefinitely. It gives a lot of options for businesses, those who already have people requirement of vaccination. No one has to wear a mask in there. That's their call. And we have very specific rules. For example, if you are appearing at a microphone temporarily, you can take it off. If you're an actor or you're in production and you're a person who speaks public. So the morning anchors on the morning news don't have to have a mask on the whole time. So we've been flexible in this enough, but also the paramount concern is making sure we get through this pandemic, get through this holiday surge, which we know is with us right now.
Governor, how are you going to enforce counties?
And one at a time, please.
Governor, how are you going to enforce counties enforcing this mask mandate, though? Are you going to be making sure, like you said, you're hoping that they're going to come around, but how in the meantime are you going to make sure that they are enforcing this mask mandate?
We have left this to the counties to enforce.
So counties can choose not to enforce?
We hope that counties will enforce it.
Governor, we did speak to the...
We expect that they will. We hope that they will. It's in the best interest of public health. But also comes down to individual businesses doing the right thing as well. So this is also, we're asking businesses to protect their customers and to protect their employees. And this is a very short-term, minor effort in comparison to what the people of this state had to go through for many months when there were complete lockdowns and people could not go out anywhere. And I will never let that happen to this state. I will continue to encourage people to get vaccinated and get that booster shot, and that is truly the best path forward. So, you had a question.
Governor, the trade group representing convenience stores is worried about violence against clerks who try to enforce it. I mean, what do you say to the clerks and to the, that are dealing with a public that hasn't worn masks since June? And really don't want to do it if they're popping into a store for 5 minutes?
I believe that they'll listen to the argument that is so incredibly simple. This is a short-term measure to protect us during a change in circumstances, which is that the infections are going up, hospitalizations are going up, ICU patients are going up, bed capacity is going down, and the vaccinations, while they're good, they are not where they could be in terms of everyone from age 5 years old and up, and I want people to get boosters. So we certainly anticipate that if there are any acts of violence, that they are addressed locally. I call on people to realize this is a very minor infringement. Children have been doing this without much complaint for many months. It allows children to stay in school, something important to me. And we cannot put this in the same framework as what we had last June when we stopped wearing masks. The infection rate statewide was hovering around 1 or 2% at that time. If we were still at that point, if people had gotten vaccinated, gotten the boosters, and we were still at 1%, we would not be having this conversation. I warned about this for months. And now we are where we are. I'm taking decisive action to get us through this as soon as possible.
Governor,
Hochul?
why are you not sending state health department inspectors to the counties that aren't playing ball? Why are you not using a bolder, as you would put it, measure to enforce this?
We're going to assess the situation. I'm going to monitor what's going on in the various counties, but I'm not attempting to be heavy-handed. I have a close relationship with the Association of Counties. I called them first while I was still contemplating this. Said, I want you to know that this is something that I believe in. They did not give me pushback. They understood. They just want to have this conversation. We'll continue to ask them what they need, as I do on frequent calls with our county leaders. Do you need a mass vac site? Do you need more personnel? Do you need more boosters? Would you like more testing kits? I've ordered 1 million testing kits to go work to counties where they want them. So I believe that there is a strong partnership where there has not been one in the past, and we'll be there to provide the resources as they request them.
Last week you had said that new Omicron cases would have been a major trigger for new restrictions or mandates because at the time when you were speaking, you had not detected any more. Hours later there were. But it still took you several days to announce this new mask and vax mandate, and Omicron wasn't mentioned in the explanation for it. I'm just curious about the thought process behind what New Yorkers can look to in terms of what to expect and when to expect new mandates like these.
You'll always find for me a moderated, calibrated approach that is not an overcorrection, but will not be an undercorrection. And what I'm talking about is when we first started seeing Omicron arrive on the scene, there was a sense of heightened anxiety given what we had seen, how rapidly it was spreading in South Africa and other countries. And at the time, we still did not have clarity from the CDC as to whether or not this was something that spreads quickly like a cold or flu, but does not have severe consequences. We didn't know at the time whether this would lead to an incredible spike in illness and therefore hospitalizations. So we didn't have the full picture on Omicron. It was something that sent off alarms in terms of could this deteriorate into a more complicated situation on top of the prevailing variant, which is Delta, or not. We still have cases arriving in the state of this variant, without a doubt. We are hearing from other experiences around the globe that had it first that it is not resulting in high numbers of people getting sick. But I set that calculation over here, and I'm looking at 3 other things and have been intently watching those 3 things, which are now, in my opinion, beyond acceptable numbers. The increase in new cases we've had since Thanksgiving, an increase of 43%, a decline in hospital capacity, number of people being hospitalized, as well as the vaccination rates. I want more people vaccinated. We get higher than we are with people, not 1 dose. 1 dose is not going to be enough. 2 doses, and now with the booster, then we'll be able to say, okay, we've done everything we can. The numbers are starting to trend down. I'll watch that. So no one will be able to stand and look at me and say, oh, yes, it's a one-size-fits-all approach, or she'll make the decision based on 1 factor. I don't. I'm very thoughtful, methodical, talk to healthcare providers, talk to hospitals, talk to counties, as well as frequent conversations with people like Dr. Fauci and people in Washington. I'm gathering all the data and doing the best I can with a very evolving situation. This could be a much better scenario in 2 weeks if people wear the mask and get vaccinated. Then I'm looking to be flexible and say, okay, we're good. We're good. Thank you, New Yorkers. You did what I asked you. I don't know what they're going to do.
Any questions on JFK?
Just a quick question for Rick. Is it correct that this terminal plan, originally the groundbreaking was supposed to be in 2020, is it fair to say the entire project is delayed about 2 years because of the pandemic? And if not, what do you think the pandemic did to the modernization of JFK?
Well, in terms of the main...
Microphone.
So we have four terminal projects which will be part of the redevelopment program at JFK. One, American Airlines started construction prior to the pandemic. So it is well underway. Facilities will start to open up the end of next year, literally. The 3 other projects, all of which were major projects, including the Terminal 1 that we announced today, the restructuring, the Delta project, and the Terminal 6 project, have all essentially been delayed 2 years. And that was a consequence of the enormous drop in air traffic and therefore the need to restructure those deals.
Governor, we're going to make our way over to Zoom. Your first question this afternoon comes from Allura Leggard from CNY-TV. Allura, your mic is open.
Thank you so much. Good afternoon, Governor. My question for you is, there are many counties like Madison County who are opposing your mandate and won't enforce masking in indoor public places. With that being said, will there be any repercussions for these counties that are going against your mandate decision? And I understand that you said before that the county executives have this power to enforce these rules, but who's going to be holding them accountable if these case numbers start to rise?
Well, I find it interesting. We're talking about 1 or 2 or 3 or 4 counties. There are 62 counties that comprise the great state of New York. I would say that the majority understand how important it is, certainly the majority where the population is, which is important to me. They understand the importance of this and are understanding that it's also a very simple, temporary measure, which is completely driven by our need to get this under control as we approach the holiday season. So I don't have overflowing beds like I've seen in other parts of the state. I just arrived back from surveying storm damage in Western New York. We had to literally send in the National Guard and nurses from downstate to help relieve the pressure in hospitals that are desperately in trouble. That is all because of unvaccinated individuals occupying beds because they've been diagnosed with COVID and the symptoms became so worse that they had to have medical attention in a hospital. And to me, that is a shame because it's keeping someone out or creating more stress on a hospital system that should not have that stress after what they've been through for the last 2 years. So this is self-induced in one sense, and I encourage the county leaders, especially those who are asking me for help, to help alleviate the crisis they have in their healthcare system, to look at their own actions and to see what else they can be doing to be a better partner to help reduce those cases by enforcing this.
Governor, your next question comes from Nick Reisman from Spectrum News. Nick, your mic is open.
Hey there, Governor. I was wondering just what the status is of the effort to kind of alleviate the hospital staff bed capacity crunch at this point. Has there been kind of a good reaction so far in terms of limiting some of these surgeries and procedures at this point, or is it kind of too early to tell?
It's a little early, Nick, but we also have been in constant communication with them, and we are starting to see the bed capacity go up in light of our cessation of elective surgeries in areas where the bed in facilities where the bed capacity was at 10% or less. We announced that a short time ago to give people time to prepare for this and adjust. Also encouraging all the hospitals to activate their flex and surge plans, which have been in place all along, and that means they have to go to contracts, which are state-sanctioned contracts, to find temporary healthcare workers. They've done this. But in the areas where they have not been as successful, we've taken some of the pressure off the nursing homes. And as I've explained before, why do we go to nursing homes? Because one institution had 50 beds filled with individuals who were completely healthy but could not be returned to a long care skilled facility or a nursing home because they didn't have the capacity. So I brought in the National Guard and some of the other healthcare providers to help in those facilities. So we'll be happy to give you the numbers. I believe at the height we've had 32 or 36 hospitals that did not meet our standard and therefore had to stop elective surgeries. I will give a report probably by the end of this week to know whether or not that has headed in the direction. I do believe it's getting better, though. It is getting somewhat better. But we're watching it closely. That's the one, as I said, that's the one that keeps me up at night. People self-resolving at home is one situation, but when they start putting a stress on our already exhausted healthcare system, and I'm talking about that from every person who works there on up to the top executives. This has been a long, grueling, almost 2 years, and anything we can do to help relieve that pressure cooker is one of my highest priorities.
Governor, we have time for just one more question. Your final question comes from Michael Gartland of the Daily News. Michael, your mic is open.
Good morning, Governor Hochul. How you doing?
Good morning. We've now rolled into afternoon. It's been a long press morning.
Oh, God, I didn't even notice. So I just want to ask you real quick, with the mask mandate going into effect, how, if you could explain it to us, this will interact with New York City's Key to NYC. You've got masks now, and you want people to be fully vaccinated instead of just one dose at least.
Mm-hmm.
Can you just elaborate on that a bit?
Well, the city's policy changes December 27th, and they allow business to have a one-dose requirement. So we'll be consistent with the City of New York on the 27th, because our state policy is 2 full doses. So those 2 requirements will align together on December 22nd. Until then, businesses in New York City can continue to allow 1 dose, but we're asking is that everyone have the option. This is what I want to give. I want to give flexibility to the businesses. I am very concerned about the businesses. That's why I called many individuals who represent the business industry before we did this, and they, by and large, were supportive. You'll certainly hear from the ones who are not, but I would say, by and large, they want to know that they can protect their customers and take the burden off of them as being the heavies in that sense, and they're glad that they can do this. So we'll have to have, there'll be an alignment shortly with respect to the options we gave, which is wearing masks or having people with 2 doses fully dosed. And again, New York City has a little period up until the 27th when their policy will align with ours. All right, well, thank you for coming out, everybody. Appreciate your time, and I thank everyone for coming out.